Good afternoon. I'd really like to thank you for taking the time to listen. I'd like to thank PPMD for inviting us to talk here. We have had the opportunity to be here at several years at PPMD, and it's really exciting at this point to be able to tell you more about our compound, CAT 1004, and to tell you more about the trial that is currently ongoing. I'm going to leave. Okay, Lee, There we go. So Catabasis is a small company. We're located in Cambridge, and right now DMD is our primary focus. We are looking at bringing this drug and making a real difference in the life of patients. We have been fortunate to be working with PPMD over the last several years. They have given us a great deal of help in bringing the drug to this point in clinical trials. And we've also been fortunate to get support from MDA as well. Now, why are we bringing CAT 1004 into a clinical trial for patients with Duchenne? You started to hear more about inflammation in this section, and you know very well that the lack of dystrophin is absolutely key to the disease. It's the reason why the disease happens. But it's more than that, and it's the lack of dystrophin along with mechanical stress that triggers the inflammatory process that ultimately leads to the disease in muscles. So we know that steroids suppress inflammation. They suppress certain aspects of what's called activated NF-kappa B, which is what the molecule that we're targeting. But we also know that steroids have significant side effects. Now, this shows the process schematically, and it's the absence of dystrophin along with mechanical stress that activates a protein called NF-kappa B. Now, NF-kappa B is activated as early as infancy. And Eric Hoffman showed this a few years ago, that if you look at birth, basically, NF-kappa B is activated in muscles of babies, and it's activated throughout the lifetime. The activated NF-kappa B does a couple things. In the center is shown that it promotes inflammation. It causes the production of cytokines, proteins that promote inflammation, and ultimately promote fibrosis. But it does other things as well. And it basically, on the right, is shown that inhibits muscle regeneration. So the inflammation prevents the stem cells from repopulating muscle. Additionally, the activated NF-kappa B specifically targets proteins and causes protein degradation in myofibrils. Now, steroids are treating the inflammation, and they're actually very good at this center part, at preventing inflammation and preventing the production of cytokines that leads down the pathway. But steroids can't do everything. And in fact, steroids themselves inhibit muscle regeneration. So we know in other diseases where we give steroids chronically, there is a negative effect on muscle, and it causes muscle atrophy. Similarly, steroids have specific targets in cause degradation of proteins in muscles. So steroids are not, as you well know, steroids are not enough. They incompletely rescue the disease. So what we're trying to do is to target NF-kappa B and to be able to address all of these. Now, you've heard a lot about MRI already this morning, and it shows some very important principles, basically, that the lack of dystrophin is necessary, but it isn't enough for the disease to progress. You know, the disease progresses differently in different muscles. So this is a cross-sectional area. This is data that Dr. Sweeney and the Imaging DMD group brought forward. And this is a control boy, midsection of the thigh. And you see that the muscle is dark, it's homogeneous. And in a boy of a similar age, 12 to 14, with DMD, the hamstrings, the quadriceps are largely infiltrated with fat and fibrosis. But there's a muscle here on the right, the gracilis muscle, that isn't exposed to mechanical stress as much. It's a muscle for more twisting the leg and turning it up, and it's not one that gets really stressed with walking every day. And that muscle doesn't show inflammation early on, doesn't show inflammation at age 6 or 7, the markers of inflammation on MRI. And then at 14, it's relatively protected. So our hope is by protecting the muscle from the mechanical stress-induced inflammation, the NF-kappa B activation, we can make a difference in the course of the disease. Now, CAT 1004 acts on the same pathway as corticosteroids. Corticosteroids, as I said, target NF-kappa B. CAT 1004 is a molecule that's composed of two parts. It's salicylate, which is present in foodstuffs. It's part of aspirin, and omega-3 fatty acid, DHA. And these are linked together in a way that they're delivered intracellularly, and they can act on two different pathways, different parts of the NF-kappa B pathway, and ultimately lead to decreasing the inflammatory markers and to potentially allowing muscle regeneration. On the right, prednisone also acts through the NF-kappa B pathway, but there are off-target effects that are not mediated through NF-kappa B and that lead to the side effects, potentially muscle damage, bone damage, that are off-target effects that are what that happens with steroids. Now, Dr. Sweeney, in his lab, looked at the compound in MDX mice, in golden retriever muscular dystrophy, and showed, among other things, this is just one slide, showed an improvement in fibrosis in the quadriceps muscle of mice, and showed improvements in the muscle mass of the gastroc muscle, the quadricep muscle in mice, and then the heart, which is starting to develop cardiomyopathy, it went in the other direction. It actually tended back towards normal. So we have brought this compound into phase 1 studies. We've studied this in adults. We haven't studied it in boys yet, in about 79 adults. And what we've seen is that the drug is very well tolerated. We haven't seen any safety signals to date in adults, or in fact in the studies that were done prior to submitting the IND to support this study. And we've seen that there is targeting of NF-kappa B, and that is shown here on the right. What we did is look at white cells from normal healthy volunteers that were given either a single dose of placebo, or a single dose of CAT 1004, or those two molecules that I said are linked together with a chemical linker, salicylate and DHA. And when you give the combination, you don't see any effect on NF-kappa B. When you give CAT 1004, you see about a 70% decrease in NF-kappa B. So it's not enough to give the two components. They need to be linked in CAT 1004 to get this effect on NF-kappa B. So we've been designing a study, we've called it MOVE-DMD, and it's particularly targeting the younger boys to target early intervention in Duchenne. And along this disease pathway, we know that inflammation starts from infancy, so potentially we could be looking across the lifespan of the boys. We're looking at the younger ambulatory boys that are not yet on steroids, and we're using functional tests that are most appropriate to that age group. So we are using, you've heard about MRI in previous studies, and now this is much more, this is the first year that lots of studies are starting to use MRI. And it really allows, through the work of the imaging DMD group, it's allowed these investigators to understand a lot more about the natural history of DMD and to look at muscle health in individual muscles as well. There's no radiation exposure with MRI, there's no injections, and it can really show you that different parts of the muscle are affected differently. So it gives you a global effect of the muscles, for example, in the lower leg. And very importantly, it's been shown that the same muscles that have inflammation are the ones that go on to develop fibrosis and replacement of muscle tissue with fat. So in this study, this initial study of CAT 1004 in boys with Duchenne, we're going to be using MRI as our primary endpoint to understand the effects of the drug. Now, the study is going to be done in two parts. We're initially doing a 1-week safety part of the study to look at safety. This is the first time in boys, and to also look at how much of the drug is absorbed, called pharmacokinetics. When that part of the study is done, we'll be then looking for the drug over 12 weeks of dosing. And we'll do this in a randomized, double-blind, placebo-controlled study. And we'll use MRI at the beginning and the end point of that study, as well as time functional tests. Importantly, what we will, because although it's a placebo-controlled study, the placebo group will cross over to the active treatment groups at the end of the 12-week period. It's schematically shown here. We'll have 3 rising doses. This will be done over the rest of this year. And early next year, we'll be starting the 12-week part of the study with 3 groups and about 18 to 24 boys in total. We have a data safety and monitoring committee that's overseeing the study, in addition to the investigators and the sponsor closely following it. And we'll be looking at boys who are aged 4 to 7. All mutations will be eligible because basically all mutations have this activation of NF-kappa B. And we will be looking at these time functional tests, as I'll show you. So the eligibility requirements of the study are shown here. Boys have to have a genetic diagnosis of DMD, but the specific mutation doesn't matter. And they need to be able to walk. And basically, these are relatively standard inclusion criteria. They need to have their immunizations up to date. They need to not be on corticosteroids because corticosteroids work through the same pathway as CAT 1004. So to understand the effects of CAT 1004 on activated NF-kappa B, we need to look, as Dr. Farkas said earlier, we need to look at the group of patients that stands to benefit the most right now and to do the right trial. So the drug is given orally, and these look really big, I realize, up on screen. This is a Tic Tac. It is not humongous, and this is the size of CAT 1004. Several years ago, Pat Furlong came and told us that the boys can take Tic Tacs, so use that as your marker, your size for capsules. And we've made a slightly larger size that's about 2/3 the size of an M&M, and these capsules will be taken a couple times a day. The other tests that will be performed, we're not looking at the 6-minute walk test because that isn't appropriate for this age group. Boys don't focus for 6 minutes, as you well know, when they're 4 and 5 years old. So we're looking at tests that the FDA, in the guidance that PPMD successfully brought forward, the guidance specifically points to the 10-meter walk-run, the 4-step climb, the time to stand. So we'll be looking at these tests in this study and getting preliminary data to be able to go on to the next study, which we believe will be then a registration study for CAT 1004 in boys of this age. And I should add that this study has been reviewed by the IRBs, it's been reviewed by FDA, who are extremely helpful to everybody in the DMD field. The study is going to be conducted at the imaging DMD sites in Florida, Oregon, and Philadelphia. And PPMD has graciously provided a grant for travel to assist families to be able to come and to stay overnight at the sites when the trial is taking place. We have started enrolling in the study, and the first patient has been dosed. So we are very actively recruiting, and it has. We We had a webinar last month with PPMD, and really appreciate people reaching out to us and having a great interest in the study. So thank you for that. We are looking at CAT 1004 as a molecule that can target inflammation, can target activated NF-kappa B, and potentially have multiple effects on the disease, not just in younger boys, but potentially across the age spectrum, potentially across the spectrum of genetic mutations. And we've also heard people talk about combination therapy. And this therapy would also work potentially with dystrophin therapies and other therapies that target different aspects. So agree with the previous speakers that the future is going to be looking at combination therapies down the road. We've been able to see positive effects in previous animal models and looked in our phase 1 program, not seen safety signals. And we are really excited to be moving forward now with the study in patients with Duchenne. So I'd like to thank you all and everybody who's helped to get us here to this point.